Hello and welcome to NCTV episode 67, which is all about how to avoid back pain with golf, aka the back pain bunker. Approximately 60 million people around the world play golf, sometimes into their 80s and 90s, which is great because the sport has many health and well-being benefits. The problem though is that despite its perception as a low impact sport, golf can be very demanding. It requires strength, endurance, explosive power, flexibility and athletic ability to perform a movement that produces some of the fastest club head and ball speeds of any sport. The golf swing produces average compressive loads on the back equivalent to 8 times your body weight. In comparison, running produces spinal compression forces equal to approximately 3 times your body weight. The effect of these repeated large forces on your body can therefore lead to pain and injury. Lower back pain is by far the most common problem experienced by golfers. It accounts for over a third of all golfing injuries and happens to players regardless of age or ability. Whilst the lower back is often the source of pain, it's rarely the cause of pain. The leading cause of pain is poor swing mechanics associated with a lack of mobility in the ankles, hips, upper back and shoulders. These issues result in the lower back being overstressed and eventually breaking down. When your back does break down, you could experience one of the following injuries. 1. Localized muscle strain or ligament sprain, which would usually last about 2 to 4 weeks. 2. Disc injury such as tears, bulges of the inner jelly-like substance, rupture or degeneration with age, where the shock-absorbing ability of the discs reduce, leading to irritation of or compression of the spinal nerves, causing pain which often radiates into the buttocks and legs, known as sciatica. 3. Altered joint mechanics or motor control, and this can begin as a protective mechanism but then lead to more chronic problems over time. 4. Degenerative arthritis. This can occur with overuse or aging, where the spinal joints develop bone spurs, thus narrowing the canal where the spinal nerves pass through. 5. Stress fractures, which are common problems seen in the lumbar spine of rotational athletes. To avoid these injuries, good body mechanics should be one of your top priorities when playing golf. Proper posture, balance, flexibility and strength work together to support a good swing and correct golf stance. To help you protect your lower back or manage the problems mentioned, some of the options available to you are either 1. Hands-on physical therapy treatments such as osteopathy or massage, which can help mobilise the joints and soft tissues around the lower back. 2. Also things like electrotherapy, dry needling, kinesiotaping, hot and cold therapy and exercises to stretch or strengthen any tight or weakened muscles can be useful. A few things to bear in mind when dealing with pain or injury. Firstly, continuing to play golf through an episode of lower back pain can cause further inflamed muscles and joints. Taking time off will allow your back to heal more quickly. Secondly, you should continue to stretch and strengthen your back between golf sessions, along with a low impact aerobic exercise program such as walking or cycling. Finally, after the lower back pain has subsided, return to playing golf slowly and apply the prevention tips that we'll cover next to help avoid any future occurrences. As with so many health conditions, a little effort to prevent injury goes a long way, and it's important to address the following 3 areas to stay out of back pain or the back pain bunker. These being your body, your technique and your bag. Starting with your body, and there are 3 aspects to focus on. These being 1, the hips and upper back, as the golf swing requires great rotational mobility to develop and transfer energy to the club. That mobility should come from the joints in the body that are designed to rotate, which are the hips and upper back. Therefore, aim to create optimal movement in these areas as your first line of defence against lower back pain. It's important to remember though that these don't operate in isolation. Ankle mobility can also affect the hip joints, and the shoulders work in tandem with the upper back, so don't neglect these joints either. 2. Core strength. The abdominal muscles may be both the most important and the most neglected muscles for golfers. These muscles promote posture and balance and provide support to the spine. Core weakness results in increased strain on the lower back during the rotational movements associated with the golf swing, and can also make it hard to maintain good posture throughout the swing. 3. Warming up. To avoid straining your back, a thorough warm-up before you start is essential. Even if it's just a few easy swings and stretch, this is critical for your muscles to get ready for the game. Onto your technique, and perfecting this won't just improve your game, it'll also prevent injury. The objective of a golf swing is to develop significant club head speed, and to do this, a lot of torque, force, or torsion, twisting, is applied through your lower back. A smooth, rhythmic swing produces less stress on the lower back, minimising muscular effort and load on the spine. With a proper swing, the shoulders, hips and spine rotate to share the load of the swing. You can achieve good balance while golfing by slightly bending your knees and keeping your feet approximately shoulder width apart. Your spine should be straight and you should be bent forward from the hips with your weight evenly distributed between your feet. Developing an easy fluid swing is often easier said than done though, which is why working with a golf pro for a few sessions is a great way to improve your swing and avoid lower back injury. Onto the bag, and repeated bending over to pick up your bag can put stress through your lower back. So some recommendations to help prevent lower back injury are: 1. Invest in an integrated golf bag. 2. Use dual straps to divide the weight across your back, or even better, add some wheels. 3. If your bag is on wheels, push rather than pull to reduce the rotational load on the back. 4. Do some walking between the holes. Riding on a motorised golf cart can benefit you in not having to physically carry the weight of your clubs. However, sitting, driving over rugged terrain can increase spinal compression and aggravate the pain. 5. When bending over to place or retrieve a golf ball, it's important to stand with one foot in front of the other. Use your golf club to support your weight of your upper body. Gently tighten your abdominal muscles and bend from the knees and hips, and never with the waist, with your legs straight. To wrap up, you can still enjoy playing golf even if you are experiencing chronic lower back pain. Don't forget, golf requires much more athletic ability than many people imagine, and ignoring the physical demands of the sport often leads many people to suffer from injuries because of poor general conditioning, lack of warming up, poor technique and limited practice. With regular exercise, including specific strengthening and stretching, and better swing technique, you can experience a significant improvement in performance and reduction in injuries. Remember, your friendly local osteopath or physical therapist can help you treat any current injuries and pain and support your prevention efforts in the future. That's all for this week's bite-sized bit to help your health flourish. See you next time.